Cholesteatoma is a condition that affects the eardrum, the middle ear, can affect the mastoid, can affect the inner ear, can affect the brain, and can affect the facial nerve. Cholesteatoma implies a tumor, but it really isn't a tumor. A cholesteatoma forms from eustachian tube dysfunction. When a patient has eustachian tube dysfunction over a period of time, they develop negative pressure in the middle ear. With this negative pressure, the weakest part of the eardrum starts to sink in. And what's happening here is that the skin, the squamous epithelium on the outer surface of the eardrum, starts growing in the middle ear. And as it grows in the middle ear, it can spread into the mastoid, it can spread into the facial nerve, it can spread into the inner ear, and it can spread into the brain. Well, how does benign skin grow? Well, you have to remember skin is a very dynamic organ, and the outermost layer of skin is actually sloughed off. When you shower and you towel yourself off, you're removing the dead keratin or skin cells. But when the skin finds itself in the middle ear, it has nowhere to shed. So what happens is it grows like a tumor, and the bone around that area remodels. Associated with that skin growth is infection. So it's not uncommon to have drainage from the ear in a patient who has a cholesteatoma. Typical symptoms of patients who have cholesteatoma are painless drainage from the ear, otorrhea, and hearing loss, although they don't necessarily have to have either. Sometimes a diagnosis is made by an astute physician who does a microscopic examination of the eardrum and notices a small defect in a part of the eardrum or retraction of the eardrum. Left untreated, this condition can worsen. The cholesteatoma can affect the facial nerve, cause a facial paralysis. It can spread into the brain and give you meningitis and brain abscess. It can spread into the inner ear and give you disequilibrium and vertigo. And it can erode the bones behind the eardrum and give you hearing loss. Treatment of cholesteatoma is primarily surgical. This requires an operation called a tympanomastoidectomy. Typically, this involves general anesthesia in an outpatient setting that takes about an hour and a half to 2 hours to do. An incision is made behind the ear. A window is created into the mastoid bone. The cholesteatoma is removed. The eardrum is repaired. And middle ear reconstruction of the bones behind the eardrum is often performed.